Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 5 NCLEX questions. Without delay, let's get started.
When an infant with pyloric stenosis is admitted to the hospital, which of the following should the nurse do first? 1. Weigh the infant. 2. Begin an intravenous infusion. 3. Switch the infant to an oral electrolyte solution. 4. Orient the mother to the hospital unit. The correct answer is 1. Unless the infant is in hypovolemic shock. Obtaining a baseline weight is an important first action because the weight is used to calculate the child's fluid and electrolyte needs. The primary healthcare provider prescribes intermittent fetal heart rate monitoring for a 20-year-old obese prima gravida client at 40 weeks gestation in the first stage of labor. The nurse should monitor the client's fetal heart rate pattern at which of the following intervals? 1. Every 15 minutes during the latent phase. 2. Every 30 minutes during the active phase. 3. Every 60 minutes during the initial phase. 4. Every 2 hours during the transition phase. The correct answer is 2. Labor is categorized into 3 phases: latent, active, and transition. During the active stage of labor, intermittent fetal monitoring is performed every 30 minutes to detect changes in fetal heart rate. The nurse is caring for a prima gravida client in active labor at 42 weeks gestation. The client has had no analgesia or anesthesia and has been pushing for 2 hours. The nurse can be most helpful to this client by 1. Changing her pushing position every 15 minutes. 2. Notifying a healthcare provider of her current status. 3. Continuing with current pushing technique. 4. Assessing the client's current pain and fetal status. The correct answer is 2. The normal length of time for pushing is 2 hours. Anything over that time becomes an abnormal situation, and the healthcare provider needs to be notified. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNurseGuide.com. Back to the questions. Which of the following would the nurse include in the teaching plan for a 16-year-old prima gravida client in early labor concerning active relaxation techniques to help her cope with pain? 1. Relaxing uninvolved body muscles during uterine contractions. 2. Practicing being in a deep meditative, sleep-like state. 3. Focusing on an object in the room during contractions. 4. Breathing rapidly and deeply between contractions. The correct answer is 1. Childbirth educators use various techniques and methods to prepare parents for labor and birth. Active relaxation involves relaxing uninvolved muscle groups while contracting a specific group and using chest breathing techniques to lift the diaphragm off the contracting uterus. The primary healthcare provider prescribes an amniocentesis for a prima gravida client at 35 weeks gestation in early labor to determine fetal lung maturity. Which of the following is an indicator of fetal lung maturity? 1. Amount of bilirubin present. 2. Presence of red blood cells. 3. Barr body determination. 4. Lecithin sphingomyelin. The correct answer is 4. To determine fetal lung maturity, the sample of amniotic fluid will be tested for the L/S ratio. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at AlphaNurseGuide.com.